First point, acknowledge the endorsement, but do your own work. Please remember, after the handoff, the patient becomes yours. Okay? So at no point in time is it okay for you to say, oh, they said it was this, so I treated that. They said it was this, so I treated that. That's kind of an amateur move. Acknowledge the endorsement, but take full responsibility for the patient. So verify the details. All the time when I'm meeting a patient for the first time, I say, I know it's the first time we're meeting. I hate to make you retell your story. It's important I get the details right. The chart says X, Y, Z. Is this correct? By the time you have verified some of these details, you probably have more questions that you want to ask if you're starting to formulate a differential. And at that point, ask your own questions, go into more detail. It's never forgivable if you get it wrong because you didn't verify details. It's not okay to get it wrong just because you believed what the person before you told you what was going on. And it's not even that the endorsement is incorrect. Sometimes what the person before you sees is different from what you see. Sometimes the patients report one thing to the first person and a different thing to you. By the time you see the patient, there's diagnostics that the previous clinician didn't see. So all those things mean it's critical for you to do your own work. For example, the ER's job is not necessarily to get the diagnosis right, but to triage appropriately and quickly. Remember, the ER's job is speed. It's your job not necessarily to be fast. In fact, I'm going to say if you're a new PA, don't be fast. Be accurate and be thorough. So it's our job to get the diagnosis right and not necessarily to be fast. So acknowledge the endorsement, but do your own work. Take responsibility fully for the patient. And the second point in this video, accuracy over speed in most cases. You're not doing any favors by churning out a lot of patients if you are setting the workup and the treatment in the wrong direction. All you're doing is making things harder for either yourself tomorrow or the person that takes over from you. So it is far more important to be accurate than to be fast. And so if that means taking the time to do it, then that's what you've got to do. Now there's an exception to this. If the patient is unstable, sometimes you have to act with incomplete information, just like the ER does, okay? Sometimes you have to make your best judgment and you don't have all the information. That's all right. Stabilize the patient. Shoot first. Ask questions later. That's the only exception to this rule. I'm going to say accuracy over speed most of the time, except when the patient's unstable. But that should be obvious.